Shock is a state when tissue oxygenation is inadequate to meet the needs of aerobic respiration, often secondary to inadequate perfusion. Simply put, the delivery of oxygen is less than the consumption of oxygen at the tissue level. The delivery of oxygen is equal to the cardiac output, or pump function, multiplied by the arterial oxygen content, or the oxygen carrying capacity of blood. Blood carries oxygen in two forms: the oxygen that is bound to hemoglobin and the oxygen that is dissolved in blood. The amount of dissolved oxygen is small and negligible, and the primary factors that affect the amount of oxygen carried in blood include the hemoglobin concentration and the arterial saturation. To understand cardiac output, let's review electric circuits and Ohm's law and see how it relates to the circulatory system. Ohm's law states that the voltage or gradient of electric potential is equal to the current or flow of electrons multiplied by the resistance or the opposition to flow. In the case of the circulatory system, voltage is equal to the pressure gradient. Current is the equivalent of blood flow, and resistance the opposition to flow in the capillary beds. In other words, the perfusion pressure, or the difference between mean arterial pressure and central venous pressure, is equal to the cardiac output multiplied by the systemic vascular resistance. Cardiac output is the heart rate multiplied by stroke volume, which is dependent on preload and contractility of the heart. It's difficult to measure preload, so we need a surrogate for this measurement. The heart can be divided into two sides, a right heart and a left heart. Preload of the right heart is equivalent to the right ventricular end diastolic volume. Since we can't measure this volume, we use the right ventricular end diastolic pressure as a surrogate measurement. At the end of diastole, there is no driving pressure for filling of the ventricle, and the right ventricular end diastolic pressure is equal to the right atrial pressure, and subsequently the central venous pressure. The same can be said of the left heart. The left ventricular end diastolic volume is proportional to the left ventricular end diastolic pressure, which is equal to the left atrial pressure and subsequently the pulmonary capillary wedge pressure. Using these pressure measurements as surrogates for preload, in addition to the other variables, we can determine the presentations of the different causes of shock. These etiologies will be reviewed in Part 2.